Centuries ago, plant-based remedies were used to cure a number of diseases and illnesses. But for the past 100 years, this took a turn, and we've become overly reliant on pharmaceutical drugs. Well, now it's time to go back. Dr. Joel Kahn is a holistic cardiologist who believes that plant-based nutrition is the most powerful source of preventative medicine on the planet. Having practiced traditional cardiology since 1983, it was only after his own commitment to a plant-based vegan diet that he truly began to think scientifically and critically about the body's ability to heal itself through proper nutrition. One of the world's top cardiologists, Dr. Joel Kahn has treated thousands of acute heart attacks during his career. His mission is to prevent all future heart attacks by educating the public and inspire a new holistic lifestyle. I'm here with Dr. Joel Kahn, and we're going to talk about prevention and disease reversal with a plant-based diet. Welcome to Plantbased.
Well, thank you. I'm very excited because this is an important topic.
Yes, thank you for coming. Someone can be reasonably healthy and feel fine. Why would they need to be concerned about silent heart disease?
Well, everybody watching, listening has to be concerned about that because heart disease throughout the Western world remains the #1 killer of men and women, and it creeps up silently, and you have no warning most often to the day a person has a heart attack or even drops dead. So you do need to be concerned because it's a very common disease, #1, and it gives no clue till the last few moments. So we'll talk about, I imagine, how you can get on top of this problem, but let's prevent it.
So I went to the doctor, I did a physical 6 months ago, I feel fine, he says I'm fine, but why do I need to do more?
Yeah, I'm really glad you asked that because there's so much information that people watching need to learn. I've been a doctor for over 30 years and I've been caring for patients. You take the blood pressure, you put the stethoscope on, maybe you run an electrocardiogram and you ask your questions and you conclude Mr. Jones or Mrs. Smith are doing okay and they go home. You really haven't even gotten a clue if this silent and progressive killer is present. It's simply inadequate. It's inadequate on 2 levels. It's inadequate on the routine blood work that's done on a physical exam when you're 40, 45, 50. Simply doesn't reveal all the causes of heart disease. And we got to do a little bit more. These actually aren't expensive blood tests. They're available almost everywhere. Some are genetic, and if you don't check them, I'll call one out. It's called lipoprotein A. If you don't know your level, you simply don't have any clue of your real risk. If you're normal, great. If you're super high, we need attention.
Okay.
And the other is that stethoscope. Doctor listens to your heart, pats you on the back, things sound good, Jim or Jane. It's simply inadequate. Heart arteries are small, they're moving, they're deep inside the chest. We have the ability to actually find out exactly how they're doing with a simple CAT scan of the heart. It takes about 15 seconds, doesn't involve any injection or IV, very safe, low radiation test. Very much like a mammogram a woman might get of her breast, you can do a CAT scan of the heart arteries.
Okay.
And you get the whole story. And the science with over 2,000 research studies says if you can find a medium or large hospital that offers a heart artery calcium scan, you really did get the checkup that America, Canada, and other Western countries really ought to get.
And is there any evidence that a plant-based diet can reverse heart disease, and are there any cases of this?
Yes, there's actually many. And the first publications that proved the point came out in the 70s, the 80s, the 90s. You'd think by now, heart disease, #1 killer in the Western world, we've had the data for 4 decades. How do we not teach this to every patient in a hospital, in an office? It's simply, sadly, not taught that the science is so strong. It's recognized again by the American insurance industry that there's only 2 dietary plans that can reverse heart disease. One's called the Pritikin program, one's called the Ornish program. There's no meat in those programs. They're plant-based programs. It's scientifically accepted that this is how you reverse heart disease. It's just not taught, which is why this show and this conversation is so important. So yes, absolutely can be done, and doesn't matter even what stage it's at. I'd always rather catch it early. It will reverse earlier, but you can have 20, 30 years of this process and still make a major improvement in blood flow, symptoms, survival, stress tests, everything a cardiologist would look at to say, you're doing better, sir, ma'am, absolutely can be done with a fork and a spoon. It's amazing.
Wow. Do you see reversal in the atherosclerosis prevention in your clinic?
Yeah, this is the coolest thing because I've practiced cardiology for 30 years and I did it the standard way for a long time. But recently in my clinic, I have the ability to actually watch people's aging on an ultrasound of their arteries to the brain. You can't do that on the heart arteries, but the brain carotid arteries are right there. And I actually can see month after month by an ultrasound, people getting younger and younger and younger. The body will heal if you take away the insult and put in the good stuff. And the good stuff is the plant-based nutrition and this lifestyle that goes along with it. So it's actually a narcotic to sit down with a patient and say, wow, you know, you've lost 10 years of age of your arteries in the last 9 months. And that's actually how quick and pretty much how standard I can show them the results. So nobody should give up hope that they can't get rid of heart disease, and better yet, don't get it in the first place. Start this diet and lifestyle as early in life as possible.
So you're helping people with the heart prevention clinic, but I hear you also have a vegan restaurant and bar?
Well, we went a little silly, the Kahn family, because about 18 months ago, that's absolutely right, a project with my son Daniel and my wife, we opened the largest plant-based bar and restaurant between New York and Los Angeles. And it's an elegant, upscale place that's there both to serve people, but it makes a wow factor. People come in every day that have never had one plant-based meal that isn't a soy hot dog, maybe. And people don't like soy hot dogs. They're eating gourmet food, several courses, desserts. There's no animal products anywhere. It's all non-GMO. And they walk out, if they're already plant-based, wow, that was awesome. And if they've never had that meal, they're very impressed that this might be something they want to look at. One meal a month, one meal a week. We welcome them back as often as they want to come. And it's busting. It's a large restaurant and it's busy every day from lunch till dinner. And now a food truck is taking our message throughout the whole city of Detroit, because we do want to reach more people and people who've never tasted a lentil quinoa burger or a superfood salad that is going to boost their health. So it's tremendously fun.
That's a great way to introduce people to interesting, healthy, elegant food. And what's the name of the restaurant?
Yeah, it's Green Space Cafe. It's in Ferndale, Michigan, which is adjacent to the city of Detroit. And very typically, I don't ask my patients they have to come to my restaurant, but I see them at 11 a.m. and then at 6 p.m. I see them dining in my restaurant, experimenting, trying, and they're hooked. So it is a powerful way to get people onto this plant-based life for their health, for their disease reversal.
That's amazing. We'll have to come and try it. Thank you so much for coming.
All right, it was really great. Thank you for having me on.
Stay tuned for more.